So one of the things that I do frequently as part of my workup is I will use Nodify with PET scanning because I find it to be very beneficial up front. Initially, I started to do it when I first learned about the test because I had to self-validate. We all self-validate tests. So I was matching it up with what my normal practice would have been. And what I found were things that were very interesting to me and very enlightening, and the fact that many times Nodify will be very concurrent with PET. If you start to see PET positive activity, your risk stratification will show that. But where it's also been helpful is that not just cancer lights up PET scans. Things like inflammation and infections and other things can show positivity on a PET scan. And again, where patients read that in their report, that they've got positivity, and a radiologist may have said this is concerning for malignancy, it has now given me an added piece of information. So I'm not just taking the pessimist role against the radiologists, where either, they're proven right or pleasantly surprised. I get to be the one that has to have this conversation with and tell them that even though I'm looking at this, I don't think this PET scan is very positive. But that's my opinion versus theirs. Now I have an extra piece of data that I can say, look, I know what they said, but I've looked at the PET scan. We've ran some extra tests on top of that. And I really think putting this together is actually looking more toward a benign nodule. And then I explain how PET scans work and how other things other than cancer can be positive. And that gives patients a sense of confidence and calm that, okay, that makes sense. Then let's go with what you recommend.
We use Nodify with PET as really a preference to try to avoid the PET scan if we can. It clearly is part of the algorithmic guidelines now. Intermediate biopsy PET is kind of the direction that the guidelines are going, although these alternatives such as surveillance, surgical resection still remain. And so how we use it is, for our region, PETs are done once or twice a week. So it's not like if I order a PET, it's done tomorrow. I might get lucky on that, but that's atypical. And so I have time to order this test, and it's the same algorithm. So this is just, our goal is to reclassify this risk. So example, 30% risk of cancer, Nodify comes back, XL2 really downgrades us down to, let's say, less than 2%. Would I order a PET scan on that patient? The answer is absolutely not, and we would cancel our PET scan if that was the direction we agreed upon. On the flip side, maybe it's a very high-risk patient. Let's make them 85 with every comorbidity on 10 liters of oxygen, and we run this test, and antibodies are positive, increasing their risk from 30 to, let's say, 80% to make it easy. We know that biopsy or resection or treatment would be indicated, but are we sure that it's worth that risk because the risk of doing any of those is so high? So a PET scan would follow that one. But other than that, I think we utilize this test to try to weed out, do we even need a PET scan or not? And if, we're indeterminate, and we're going to probably open the door to that here a little bit, then maybe a PET scan is not a bad very next step, and that's, how we would use the PET scan.
We use Nodify and PET concurrently. In my mind, they're not mutually exclusive. They're complementary. PET scans are expensive. We get them anyway because they are important in the lung cancer workup, but we do Nodify as well. When I first started using Nodify, I had my usual kind of appropriate new test hesitation. So if I had a nodule that was PET positive, even if Nodify said low risk, I would still err on the side of caution and go after a biopsy. Now that I've used Nodify as a group over 400 times, I developed a new level of confidence in the test. And so I will actually believe Nodify over a PET scan. PET scans are inherently very, very sensitive, but they are not specific at all. So if that nodule is hypermetabolic on a PET scan, it may be that they have lung cancer, but it can also be hypermetabolic from infection or from just inflammation in that area. Nodify can discern among those different possibilities.